What if 2020 was just normal? No lockdowns, no masks, no fear. What if COVID-19 never existed? Global markets would have continued as predicted. No major crashes, no trillion-dollar relief packages. The gig economy might have grown slower, and inflation might look very different. Travel plans would have flourished with families planning vacations and friends organizing spontaneous weekend getaways. Tourism would have thrived with no restrictions on travel, leading to unforgettable experiences and cherished memories. Schools would have remained vibrant hubs of learning, and sports events would have attracted full stadiums without any health concerns. Communities would have thrived with gatherings and celebrations, bringing people closer together to share joy and connection. Remote work was still considered unconventional, often met with skepticism, as traditional offices remained the norm. In those early days, many wondered if tools like Zoom would become mainstream or just fade into obscurity. The gradual shift towards remote work would have likely taken years to establish itself as the accepted way of working. During this time, advancements in artificial intelligence, online education, and automation might not have gained the momentum they currently possess. In this alternate reality, coffee shops and informal workspaces might still be seen as mere temporary office substitutes, rather than integral parts of the professional landscape. The rise of e-learning could have been slower, limiting access to knowledge and opportunities for many. In a world untouched by collective trauma, people experience harmony in their daily lives, fostering connections and communities that thrive without the strain of isolation or anxiety. The absence of global anxiety allows communities to flourish as individuals come together to empower one another through shared experiences and open dialogue. In this nurturing environment, creative expressions blossom, encouraging individuals to explore their emotions and share their stories without fear of judgment. The shared experiences in safe spaces deepen friendships, as the community values emotional well-being and champions mental health in everyday life. These gatherings promote awareness and understanding, highlighting the importance of mental health education and support systems available to everyone. In this supportive environment, children learn the value of cooperation and empathy, while adults find strength and solace in communal practices that enhance their mental well-being. The world was always skeptical about politics and trust, even before the pandemic altered the social landscape. Would governments have tackled the issue of trust differently if they were not faced with such a crisis? Beyond the discussions and debates, the constant battle between science and misinformation persisted, leaving citizens questioning their sources. Ultimately, the situation revealed not just the resilience of leaders, but also their vulnerabilities in an ever-changing environment. In town hall meetings across the nation, citizens demanded transparency and accountability from their leaders, seeking answers to questions that had long gone unaddressed. Meanwhile, headlines in newspapers captured scientific breakthroughs, yet were often drowned out by sensationalism that muddied public perception, raising doubts rather than fostering understanding. Imagine a world where education flourishes without interruptions, where school years are cherished and abundant. In this alternate reality, Generation Z thrives in vibrant classrooms, forming connections and friendships that shape their futures. In this setting, friendships blossom effortlessly as young minds engage with one another in person, fostering deep bonds that last a lifetime. They participate in extracurricular activities, honing their skills and discovering new passions together. As students dive into extracurriculars, they learn the power of teamwork and dedication, building confidence as they pursue their interests. This active engagement shapes well-rounded individuals who are ready to take on challenges and embrace their future. Through discussions and debates, they develop critical thinking skills, unafraid to express their opinions and listen to differing perspectives. Their commitment to community service instills a sense of responsibility and connection, reinforcing their role as active citizens. As the world grapples with lessons learned from past health crises, a question persists. Will society prioritize future preparedness? In settings filled with eager participants, discussions revolve around embracing essential measures like hand hygiene. The choices between valuing freedom and the comfort of security hint at the complex nature of human behavior. In homes across the nation, families convene strategizing on how to stay ready for unforeseen events. The atmosphere is charged with a blend of urgency and hope, as community members participate in activities that reinforce the importance of collective resilience. In educational settings, young minds absorb crucial knowledge on public health inspired by stories from past pandemics. Meanwhile, in tranquil parks, conversations unfold as individuals reflect on their values, weighing the balance between health safeguards and the allure of social freedom. We can't change the past, but we can learn from it. COVID-19 reshaped our world. Imagining a world without it helps us understand how much we lost and how much we grew. The streets, once filled with laughter and activity, fell silent. Yet as the world slowly reopened, we found new ways to connect and thrive, celebrating the resilience that emerged from our struggles. Healthcare heroes worked tirelessly, showing immense courage in the face of uncertainty. The joy of reunions reminded us that every moment together is a treasure. Classrooms transformed into spaces of caution, where learning continued despite the challenges. Innovative methods emerged, proving that knowledge knows no boundaries. As communities rallied to support local businesses, a newfound appreciation for what was close at hand blossomed. Individuals began to prioritize their well-being, embracing practices that nurtured both body and mind.